Here's something they don't teach you about traction splints when you're training to be a paramedic. So traction splints are brilliant devices when it comes to managing someone with a femoral fracture, but things become a little bit more complicated when there's a concurrent pelvic fracture involved, and often the question is asked, should we apply the pelvic binder or traction splint first? And I'm going to try and physiologically tackle this question in a moment, but before I do, these are exactly the sort of niche topics I talk about in the trauma book linked in my bio, so if you're interested, be sure to check it out. Now, we have to remember that the traction splint applies longitudinal force across the femur, and that force gets applied to the pelvic ring, which is fine in the context of a stable pelvis, but if the pelvis is damaged or fractured, this force can cause a further opening of the pelvis, which can exacerbate bleeding and increase pelvic volume. The pelvis needs to be stable to handle the force applied from the traction splint, so consider binding before application of your traction splint.